Why are Black people still being prescribed this medication for high blood pressure? Hi, my name is Shannon. I've been a registered nurse for a little bit over 10 years now. I want to bring up this subject of why Black people are still prescribed ACE inhibitors for high blood pressure when Black people constantly are having these types of reactions. Sure, there are some Black people that ACE inhibitors will work fine with and they'll have no side effects, but Black people are 3 to 5 times more likely to have angioedema, which is swelling of the mouth, tongue, and the throat, which is a medical emergency. So ACE inhibitors are medications that end in PRIL. So like lisinopril, enalapril, anything that ends in PRIL for high blood pressure, those are ACE inhibitors. So I have had African American patients that complain about the same side effects, the swollen lips, the swollen tongue, all of that kind of side effects while taking ACE inhibitors. There are other blood pressure medications that a person can take. Yes, one medication may work for somebody else and it may not work for you, but that's why you need to advocate for yourself. Always advocate for yourself. You might go to a doctor where all they like to prescribe is ACE inhibitors, and it may work well for their Black patients, but that doesn't mean it's going to work for you. So if you need an opinion from another doctor, do not be afraid to do that. There's nothing wrong with you advocating for yourself. This is your life. This is your health. Always advocate for yourself. If you feel like something is not right, if you feel like you need a second opinion, do that. These doctors are not God, y'all. These doctors are not God. Us nurses are not God. None of us healthcare people, none of us people in this world are God. We are just going by what we have learned and what we have experienced, and we go by evidence-based practice. Other blood pressure medications would be things like ARBs. They end in SARTAN, which are sartans. You can also do calcium channel blockers. You can also do beta blockers. And you can also do diuretics, which, make a person pee a lot, which a lot of people don't like, of course, understandable. But there are other types of blood pressure medication that people can take. Not just African Americans can have these side effects, but it is most common in African Americans to have these side effects with ACE inhibitors. If you've had these side effects, or if a medication is just not making you feel well, always get a second opinion, whether that's you getting another medication from your current doctor or you going to another doctor to see if there's a better treatment plan for you. Always advocate for yourself. Never feel bad for that. All right. God bless y'all.